Good morning. Well, I know that people are still joining the session, but I wanted to welcome everyone to this second section of the ALD Connect Bootcamp for Cerebral ALD families. Um, on behalf of ALD Connect, I'm Kathleen O'Sullivan Fortin. I want to thank you for taking your time on a Saturday to come and be part of this process and to learn a little bit more. I also want to thank our sponsors. Without Bluebird Bio and their continuous support of ALD Connect in our programming, we wouldn't be able to put on this program today. I also want to just quickly read our disclaimer. Um, this webinar is for informational purposes only. The discussion is not intended to be a substitute for professional medical advice, diagnosis, or treatment. If you or a family member are ill or suspect that you and a family member are ill, please seek professional medical attention immediately. ALD Connect does not recommend or endorse any specific physicians, treatments, procedures, or products, even though they may be mentioned on this webinar. And so it is now that that busy work is done, it is my pleasure to introduce you all to someone you may or may not know, but should know. Gina Cosino is a force of nature, sometimes known as Mama G. She is a tireless advocate in the ALD space and for nutritional health and well-being for everyone. Um, she has started and run the Be a Hero, Be a Donor Foundation, and today she's going to take some time to walk us through her journey through transplant. Gina, thank you so much for being here.
Thank you, Kathleen. I am most blessed to be with all of you. And I have no disclaimers other than I have a definite opinion on the journey of life. And so here we go. I'm going to talk about my transplant journey with my son, Evan Christian Cousineau. It was 14 long years ago, and it remains etched in my being. And I want to share it with you. Not much has changed in the transplant process. It really allowed me to become an advocate of sorts for not only my son, but myself as a parent going through the transplant process with my son and other parents on that same transplant floor as we were all fighting for our children's lives, regardless of the disease process. So, for us, I'll just say that we got dumped into the ALD world on April 30th, 2007, some 14 years ago, almost exactly. And on May 1st, we learned that our son was diagnosed with advanced late-staged adrenoleukodystrophy. And we were told that there was no treatment or cure. Over the next 24 hours, with a bit of research by us and our physicians at our children's hospital in Southern California, we learned that bone marrow transplant was a potential treatment cure for our son, and hence the journey began. We had no family history of adrenoleukodystrophy. It started within me. And like many of you, I have 4 children. I have the odds hit perfectly with one of my 2 girls as a carrier and one of my 2 boys affected. And this is our family. You can see on the left here, our family. This was what ultimately ended up being our son's Make-A-Wish. We didn't know it. It was the August of 2006. It was a really beautiful, wonderful experience that we are most grateful that we had, because we had no idea some 6 months later what was coming to us. Evan was a vibrant 3-sport athlete. He played water polo, ice hockey, and he was a swimmer. He has a twin sister, Elena, who is now 23 years of age. And unfortunately for us, we ran into complications during the bone marrow transplant process due to a secondary infection. And we did end up losing Evan the day after he and his twin, or excuse me, the day before he and Elena's 10th birthday, while we were at the University of Minnesota, exactly 6 months from the day he was diagnosed and 5 months into the transplant process. Now, I will tell you that 14 years later, that our researchers and all of the tireless advocates for ALD have allowed us to come forward in a most wonderful way, and that we don't see outcomes like Evan's as often due to the fact that we have newborn screening in so many states now in the United States, and we're able to identify our boys early and siblings that might be older who are affected, as well as carriers. So really the future for ALD and the knowledge of the disease process is important. And had we had newborn screening when Evan was born with Elena, we would have likely had a lively, vibrant, intelligent 23-year-old young man with us as well. But let us move on. The decision of taking your son to transplant, happens as a correlation between you and your doctors. It is a decision you make together and a shared decision making process, let us say, and you will know whether or not the process is for your son. I will tell you, with a late diagnosis boy, which I hope never to see again in my lifetime with any of you, is that we were given three choices. They told us, take him to transplant. We're not sure it will happen. Take him home, but we're willing to transplant him. Probably one of the most difficult decisions we will have ever made in our lifetime, because we had a vibrant boy who at that point in time had only lost a little bit of the ability to process hearing and his vision. We knew that transplant was our only option. And I kept saying that, if we have a donor, a sibling match, if we can have a match for Evan, if we can make all the wheels come together to make this thing start moving forward, that we would take him to transplant. And so that is what happened to us. I will tell you that once you make the decision to go to transplant, it is imperative that you understand the importance of, number one, keeping your child safe during the transplant process, and number two, really owning that this is the opportunity for a second life for your child. For without bone marrow transplant, or cord blood transplant, as Troy Lund had stated, there's so many words for it. Whatever your transplant might look like, is that you need to understand that without transplant, your child's disease will progress. And that progression will lead to a really horrific outcome. And so transplant is our second hope, and you cannot deny it, and you must celebrate it. And at this point in time, as you're getting ready to go to transplant, it is when you really need to take advantage of making the time to have that Make-A-Wish, or there's so many other organizations out there that are willing to help in some kind of way to really allow your child, siblings, and families to really celebrate the new life that will be given to your child. Secondly, when your child goes to transplant, they will lose all of their hair. They will look very different during the transplant process due to all the medications, the steroids, the hormones, everything that they are given and that happens to them during that time. And so it's important to remember what they look like previous to transplant. And by the way, they will look like their normal self post-transplant, but during the transplant period, perhaps that 3 months, 6 months, even into a year process, they are not going to be their normal self, just like anybody else who goes through chemotherapy, leukemia treatments, blood cancer treatments. And so we really want to take that moment in time and celebrate it, and really take advantage of getting a professional photo shoot with all of your family members, because we really do want to be able to take that photo. And I'll tell you this, take that photo of your family and you put it in your child's transplant room, because it's really important when those transplanters and all the other medical professionals that will come into your life come to your child's bedside and see this boy now who is potentially with a really round moon face and lost all their hair, and then their hair might come in darker or lighter than it was previously just due to the medications, that they can see who your child is and who your child will continue to be. And I think it's also a time for celebration of hope. Kathleen mentioned that we started the Be a Hero, Become a Donor Foundation with Evan as the catalyst, but really for every patient that was in need, is in need, and will be in need of some type of bone marrow or cord blood transplant. And all of these patients needing blood and potentially needing organs at some time in their life, depending on their disease process. And I think that celebrating is really important. And I say celebrate perhaps with a blood mobile right outside of your house, because when your son goes through transplant, they will need lots of blood products that will come from the community members of where your child is transplanted. So let's give back. Perhaps contact me and we can partner that with a bone marrow drive, so that people can participate in providing hope for patients around the world, not only in the ALD process, but for patients all over the world for every blood disease that is out there and so many other disease processes as well. Maybe make that celebration of Hope event a fundraiser for ALD Connect or any of the other organizations out there that are advocating on behalf of our children and our family. So I think it's a really important time to take advantage of all of these options, and people want to help. So while you, the parents, are in the midst of trying to figure out what this is looking like, working with your insurance companies, working out the logistics with the physicians and all the powers that be, there are people in your life that keep knocking in your door, texting you, messaging you, who want to help. Well, guess what? You can get them into play, get them to contact Make-A-Wish or the other organizations out there, have them find the photographer for that photo shoot, allow them to put that organization and that event together, and we can now get ready for this really miraculous event that is about to transform your child's lives. Dr. Lund talked about workup week, said it could take from, 3, 4, 7 days. It really depends on your hospital and the group that you're working with, and the timing of getting everything in. For us, we live in Southern California, San Clemente to be exact, and we at that point in time, 14 years ago, made a decision to go to the University of Minnesota Children's Hospital to work with Dr. Lund and Dr. Orchard and Dr. Charnas and all the wonderful transplant doctors that really propelled the opportunity for the work of ALD and transplant for our son, and hope, most importantly for you. So for us, we were leaving our house. So it was important to understand that we were going to need housing. I knew that I would be in the hospital 24/7 with my son, and we'll talk about what your room will look like when you get there, but it's important to establish a home away from home, and your hospital may be partnered with a Ronald McDonald House, another type of organization that might have respite for you. You might decide to rent a home or an apartment. Your hospital, though, will help partner you with what's best given your situation. Do not worry. There are people there to hold your hand, but remember that you have to be able to be vulnerable and ask for help in the process if you're not hearing these things offered to you. So we had the Ronald McDonald House right there in the Twin Cities area within a few blocks, which we could walk. We came to Minnesota on June 11th, 2007, in the most beautiful time of year in that part of the Midwest. And we had the opportunity to explore Minneapolis during this time. While we did many other things, we had many doctor's appointments, we had blood draws. Evan had MRIs and CT scans and met with pulmonologists and went through neurocognitive evaluations. We also met with Child Life, and you can see down in the bottom left corner the opportunity for Child Life to really work with your child. They use dolls and stuffed animals to help them see, some of the procedures they're going to be going with. And this is really the start of what your child will earn, which is called their beads of courage. So I want you to make sure you remember this and ask about it in case it's not mentioned to you. But your child will go through dozens, if not hundreds of procedures over the course of their bone marrow transplant. And for every single procedure and event that they go through, they will earn themselves a little bead. And over the course of time, you will have a necklace that will perhaps be a mile long, but those are beads of courage that the child earned. And I want to make sure your child gets each one of them. Along with all of these things that are happening within the clinic, in the hospital setting, I want you to really be able to explore your community. I want you, if you have a Ronald McDonald House or other respite house, I want you to explore every single aspect of it. There are playrooms and gymnasiums and game rooms and so many wonderful opportunities for the children and the families and the siblings to partake in, especially when that child's in the transplant process. They will be in their negative pressure room, as Dr. Lund mentioned, anywhere from 21 days plus, and that plus can be anything. So we really have to stress that we don't know what it is. The best case scenario is that they are discharged back to their home away from home in that 3 to 4 week period of time. But even during that time, the kids are very immune compromised. And I guess the one benefit we can look at with COVID is that the children know how to wear masks. I will tell you that it was very foreign, just like it was foreign to your children when they had to start wearing masks in 2020. But this is just part of their life now. And again, with COVID, it's just part of their lives as little children anyway, really for all of us. So really, those masks, as we know, can keep us safe from so many diseases. And it's imperative to keep your child safe during this immune compromised period, really over the next year in their lives, especially while they're taking all of these medications to support that transplant process. But this is your opportunity to explore. This is your opportunity to connect with organizations that are within your community that you will be living, that provide hope and joy and opportunities for your children. There may be an opportunity to go see a sporting event with your child and family members. So these are all things that you want to speak with all of the individuals that we'll talk about in a little bit, who will be placed at your disposal, but you do have to open your mouths and ask for these things. Once workup week is completed, it now begins to our countdown to transplant day. And I need to fix this slide because it is day 0. And this is my husband, Mark, and this is my sweet, precious Evan, 9.5 years of age. At this point, he had lost a little bit, as I mentioned earlier, of his ability to process hearing, and he had lost the ability to see peripherally. But I will tell you, he was as cognizant as anything. And because he was an athlete, that kid was running around the halls of the Ronald McDonald House and down to the river, the Mississippi River, or down the stairs to the Mississippi River on the regular. So we were really trying to find as much joy as we could during this period of time. But we did pack up his suitcase, and we marched ourselves to the University of Minnesota Children's Hospital up to floor 4A, which is no longer the transplant floor because they did build a brand new children's hospital in Minneapolis. And we began our journey. The transplant rooms are really like suites, and it is really meant to be everything that you could possibly need over the next 3 to 4 weeks and possibly beyond. These rooms turn into intensive care units. Most procedures can take place in this room. X-rays will take place in this room. Most anything that needs to happen can take place in this room. They are negative pressure rooms, again, to keep all the germs out. Oftentimes, depending on the scenario, you might be gowning and gloving, depending on what the scenario is with your child and how compromised they are. But as long as you're in that room with them, you too are considered a safe zone for them. And you will have a place to make your bed, to lay your head every night. You will have comfy, cozy chairs. And you can certainly bring things in like a little refrigerator and other things that will make things nice for you. The nice thing for you is there is always a little kitchen nook out in the halls of your transplant unit, which is a wonderful place to be able to connect with other families who are locked tight in their little rooms. And those conversations would often happen late into the middle of the night when our children were sleeping, and we would wander out in the midst of the beeping IV poles and lights that are flashing in our room, and have some pretty vulnerable and intimate conversations and learn about what was happening in the other rooms around us as well. And that's really important in the process because you will understand that you are not alone in this journey. But your transplant room should be your home away from home. And this is where I encourage you to really decorate it as their room should be. And this is where, when I mentioned before that people want to help, this is when, especially if you are far away from home or even not far away from home, where you could have people send you things like the kids' favorite sports team memorabilia and pictures and anything that will make them happy. You know, encourage classmates to send cards and photographs. And really, we just want to give the child as much joy and comfort just like at home. I wasn't able to find any clear pictures, but this is a picture of what Evan's room looked like as somebody would approach it at the on his floor. We were on our countdown day, and there was a whiteboard there, which you could see that we were counting down at that point. It was 11 days to transplant. We were very big Duck fans, and Evan had actually gone to the Stanley Cup game that they won in 2007. It was really wonderful. We had friends and people that knew us that allowed him to ride the Zamboni and be at all of the playoff games, and it was really a delight to be able to see him in his in most joyful moments. And I wanted anybody who walked in that room to know what Evan looked like pre-transplant. As I mentioned, during the transplant process, they're going to look different. It is temporary, but I wanted him to know that Evan was a twin. I wanted them to know that Evan had 4 siblings and a mother and a father. I really wanted them to know who Evan was, that he was a Charger fan, that he was an ice skater, that he, or hockey player, that he played water polo, that I wanted them to see who he was. And I really encourage you to do the same. Again, maybe you get to the transplant process, maybe you travel across the country like we are and you don't have the things you need. This is when all those people who are messaging you in some form or another want to help. Now you can tell them what you need to help. And then, we have this countdown, right? Troy mentioned, the number of days of chemotherapy and potentially radiation, depending on where you're being transplanted, can vary. But they know exactly what it will be when you start the transplant process and that first day of chemotherapy. And now it's the opportunity with figuring out how to fill your days. The boys, I will tell you, are really pretty healthy, especially if you bring the boys to transplant early, right? Which is our goal with newborn screening and following them with your care teams once the diagnosis comes, and looking at their regular MRIs and endocrinology visits and neurology visits and so much more, that we have really healthy boys who now get into this scenario of being stuck in this hospital room 24 hours a day, 7 days a week. And I will tell you that the hospitals, especially these wonderful children's hospitals, offer so much. So it is up to you as the parent to see what is available to you. And I will tell you, before you go, before you actually get locked into those rooms, you will get a clear vision of what this will look like. You will get a nice tour of the facilities. Even so, I will tell you that there's so much going on, in your head at this moment in time, thinking about what's happening in your life and how it could possibly be happening to you and your child. You're not going to remember so much. So this is again where the care team that I'm going to share with you in a little bit is there for you. We looked at people like Child Life to say, hey, what games do you have and what can you bring into the room? You can bring in big screens, and I know that things have changed in 14 years, but there's so many gaming opportunities that are available to the children with Xboxes and things like that. I know that at our children's hospital in Orange County, we had Radio Disney because we were near Disneyland. And so they had a radio station that was going on most hours of the day, where they would bring in celebrities. We have the Angels and the Chargers and the Ducks and so many other sports teams near us that would come and visit the children. They would have games and music that you could watch on your screens in your rooms. You can see in the bottom left-hand corner that we had Minnesota Vikings visiting us. And I think Mom enjoyed that more than anybody else. Again, I mentioned the Child Life opportunities, where they work with your child using dolls and stuffed animals to really help them, kind of play doctor on these animals and then prepare for what's going to be happening to them. I know that Troy mentioned that they will get a central line, and you'll see in a moment a picture of Evan with that central line that's right here on the chest. During that time, you're going to learn how to care for that central line, especially when you get out of the hospital. But that central line is there as the lifeline for your son. That is where they're going to get all the blood products. This is where we will be able to give them those donor cells that they're going to receive. And your child's going to need a lot of blood taken and given. And we want the child to make sure that they understand what the process is. And I want you to understand that poking our children once they are in the transplant process is really something that is limited and that we don't want to do. And we want the children to know what's going on should we need to get in with a poke on occasion. So there are just so many wonderful things that are available to us. You will get inundated with packages and gifts from people who are following your story. So take advantage of those things, be prepared to donate those things at the end of it, because nobody needs all the things that you will have given to you. But this is an opportunity to keep your child busy as you're counting down the days to transplant. And then as they're healing and getting better and able to come back to life, as they're moving through the transplant process, you'll be pulling out those games once again. And then there is the Hope of Transplant Day. I really can't communicate to you how important it is for you to own this day, that without transplant, our boys with advanced ALD would not have an opportunity to survive. So this is a day of hope. It is their new beginning. It is their second birthday that you will celebrate forever. And it is a day that will never be forgotten. And for this opportunity, we are grateful. I think it's really important to understand that this is not a procedure. Your child is not being taken into an operating room. It is really a simple transfusion of cells right into their Hickman line, just like all the blood products they will receive in the coming days and weeks as they go through transplant, as does any patient who goes through transplant. But it's a very quiet and calm day. And it's important to understand that it's an emotional day for everybody. My husband had to stay back in California with our other two children who were in school at that time. My 20-year-old daughter came to Minnesota with me and stayed the entire time with me. And we had, even back then, 14 years ago, had an opportunity to somehow, I don't remember what the technology was. Oh, I think it was Skype, have my husband and anybody that was home at that point in time, be with us as they started the stem cell process. And for us, it was donated cord blood as those cells were transfused into his body. We had beautiful soft music on. The blinds were closed. It was a beautiful, somber moment in our lives, knowing that the hope we had on this day. You can almost think of it as a day as your child was born in that maternity suite that you might have been in, and you keeping it calm and quiet and peaceful and having beautiful music. And that's what this day is. And that's the way I want it to be for all of you. I want to share with you those two cord blood donors that gave us hope. I will tell you that I had hoped for a donor match from our siblings. We knew that we had 3 siblings, even a twin sister. We learned very quickly that the odds of a donor match were slim to none, that 70% of patients would not have that donor match from a sibling. As with the odds, we met those odds. And so we then had to look for cord blood donors, and we found ours. One was a 2-year-old girl at the time. The other was a 9-year-old girl. And I'll always say that I am most grateful for those parents for saying yes to cord blood donation when their babies were born. And I always used to tease Evan. I said, those girls are going to get you. And he'd go, no, I don't want those girls. And we did want those girls. We wanted those girls' cells to now take over his immune system, to grow and flourish. And they did. Evan fully engrafted some 3 weeks later, and we had so much hope for our son. You can see, Evan laying here, having those beautiful cells transfused into that central line that is in his chest. I will tell you, it felt just like the day I was giving birth to him. And it needs to be calm and quiet and lovely and a supportive day for your child. And then we begin to pray and hope and cross all of our fingers and toes as we allow these little seedlings to grow. During this time of transplant, you will have a large team of physicians that will be there to hold your hand. It's important to know kind of the hierarchy of what's happening. You will have your bone marrow transplant physicians there. You will have the attendings, and there will be several depending on how long you are in the hospital. The attendings are typically on for a week at a time. They are supported by fellows who are the next step down in terms of their processes. These are all full-fledged physicians who are simply in the game of learning their specialty and working with these attendees who are the experts, and they are experts in their own right. And those fellows tend to be on for a month rotation at a time. And then you will see some residents. Residents are typically, maybe they have their residency and working a segment in the bone marrow transplant unit. They might be working other groups as well over the course of their residency. You will also see residents who are coming in on for the night shift and weekends, along with physician's assistants and nurse practitioners. But it's important to know that those attendings and those fellows and the nurse practitioners and the physician assistants that support them are really your go-to physicians, medical practitioners at the time, having to do with the bone marrow transplant portion of your son's journey. Along the way, we have a whole list of subspecialties, which I will tell you, we hope never, ever, ever come into your room. But unfortunately, in our world, every single one of these individuals came into our room. And we talk about things like nephrology with the liver and endocrinology with all the endocrine organs and infectious disease. Remember, I told you that Evan was infected by the adenovirus. Cardiology, the heart gets affected by all of the drugs and the chemotherapy that your children go through. Pulmonology. I want to talk more about palliative care because I know the word palliative care is scary to you people. Palliative care is not necessarily hospice care, which is end-of-life care. Palliative care is comfort care, an opportunity to allow these palliative care doctors to be part of your team. And I'll tell you what, I will walk back what I said, that I hope none of these physicians come into your life except for palliative care, because the palliative care team is there to hold your hand through the process as your child might be suffering through nausea, through different things like graft versus host and different infections they might get in their mouth due to all of the drugs they're being given. The palliative care team, when you can separate them from their role as a hospice team, is there to help you decide on treatments and procedures and perhaps medications that might help your child be more comfortable during the bone marrow transplant process. And I want to really emphasize how the palliative care team can provide comfort to you and your child during the transplant process when you are still in the fight for their life. At some point in time, you may see the intensivist, if your child's room turns into that critical care room, as I talked about. But there are so many different type of subspecialty physicians out there that might be part of the process, but understand that the BMT doctors are in charge of your bone marrow transplant journey until you, the parent, might make a decision to hand it off to one of the other subspecialists, depending on the journey that you take with your child. And for us, it did turn into palliative care and then into hospice care. I think it's important for you to understand your choices in the journey, that on the transplant floor, when you get there, you're going to meet many nurses over the course of the first few days. And it is over the first few days that I really want you to start deciding, right? Choosing, like you would choose a spouse, who is that primary care nurse that you can live with for the duration. Now, remember, I'm hoping you're only there 3 to 4 weeks. We were there 5 months, and it was really imperative, given we had no idea what the journey would look like, to find that nurse, male or female, that touched your heart, that connected with your child, that listened to you. And so it's important for you to know that and to start identifying who that person is. This primary care nurse does work 3 12-hour shifts during the course of a 7-day work week. Along with this primary care nurse, you can pick another a few other nurses that can be part of that team when on the 3 days and the other half of those 7 days that your primary care is not with you. So it's important to establish a team of nurses that really connect to you, who hear you and really, I feel, love your child. I will mention to you that over the course of this time that you may have opportunities. I don't think that's the word that I want to use, but there may be times when you will see nurses that are not on your care team, right? They're not on your list of those that are special to you. And unfortunately, this is the nature of the game, being that you are in the hospital 24/7. And if you look at how many 12-hour shifts there are, there's 14, and you will not have 14, names on this list. But again, if they're working 3 shifts during the course of the week, we can now narrow down the number of people you need. But still, people take vacations, still, people get ill, still, people have reasons that they can't come to work. And this is where you'll see other nurses who are part of the bone marrow transplant floor, and you may see float pool nurses. Now, I will give credence to every float pool nurse out there because it's so difficult, because they are floating throughout the hospital, and they end up in places like critical care and BMT floors where they may not have a lot of experience and may not know what you are going through. And unfortunately, there are times that you're going to get a float pool nurse or another nursing staff member who is just not going to be acceptable to you, the parent. And I will tell you that I have a handful of times that nurses were kicked out of my room, but this is where I'm telling you that you get to choose the journey. And there comes the other nursing staff that I want to talk about in terms of the hierarchy. The next step for you, if your primary nurse or your nursing care team or the float pool nurses are not meeting your needs, that is when you get to push the little button on your uh, child's little remote there and call in your charge nurse, because the charge nurse is the one that you get to be vulnerable with. This is the person that, is really a very strong individual who's willing to take what you have to give them, because you're likely not going to be in a good mood. You're not going to be happy. You likely are not sleeping well nor eating well. And this is the person that will help to guide you. I want you in all cases to treat all of these people respectfully, because you never know how long you're going to be there and how often these people will show up in your room. So it's important to forge healthy relationships with these people. But these people also know the stress you're under as a parent that is watching their child go through this really precarious bone marrow transplant journey. But the charge nurse is there when there is a problem that your nurse, your primary care nurse, your nursing team is not able to handle. And this is the person that you can say that, this is not working with this particular nurse. I need it changed, or I'm concerned that this medication was not given on time, et cetera, et cetera. And then if there are problems within this charge nurse that you are not feeling that are being met, or the charge nurse is not able to help you at this point, that is when the nurse manager is called in, who can now really deal with things on a much broader level within the hospital. So realize the hierarchy and that you have choice along the way. What's important to understand is that you have a whole other huge care team that is there at your disposal. Some you want nothing to do with, some will be much necessary, and some are just going to be part of your everyday life. And it's important to start identifying when people come into your room who they are, looking at their badges. Perhaps in your hospital, the medical assistants might wear a different color scrubs than the nurses. So you start to identify who's who and really understanding who that person is, and keeping notes, right? Writing down who came into the room, what their name was, what they wanted, what they said. It's really important that you have a log of what's happening, so that at any point in time you can go back. Hey, wait a minute, on this date this was happened, this was told to me, I don't understand why things have changed. All right, it's really imperative that you journal what's happening, even with all the medications and your child's sleep and urinating and all of these things. Medical assistants are there to help your nursing team. They will be doing things like blood pressure checks and temperature checks and all of those things. There is a definite need in the journey pre-transplant, in the middle of transplant, and post-transplant, where you need physical therapy and you need to ask for it. Occupational therapy as well. Speech therapy, perhaps. Respiratory therapy will be offered and brought in when your child might need it as well. But then there are also other lovely things like music therapy, which allow you to find some solace and peace within music, and you need to take advantage of these things. Pharmacy is going to be part of your daily life, and it's important for you to double check the medications that are coming into the room. Even though you feel like there's a check system that's happening, I want you, the parents, to take that responsibility and make sure you are looking at every medication coming your way. You can snap a screenshot of it, you can write it down, but be aware of what is given to your child and when, and then the side effects, the benefits, the repercussions as you go, so you can talk about these things with your transplant team when they round every single day. Your social worker is going to be there for you for a multitude of reasons. And my hope is after this particular boot camp that we're going to have another boot camp where we really delve into exactly what all of these specialties do for you. There will be a care coordinator that will help you as you get ready to leave the hospital, getting you training in terms of how to take care of your child, and perhaps they might have a port, or they continue to have that central line, and anything else that's happening with your child. The child and family life specialists are paramount in the journey. Not only for the support of you and your child, but for the support of siblings as well. Depending on your hospital, I know in Minnesota, they have care partners, which is our volunteers that they partner you up with. And perhaps you need a trip to Target, maybe you need supplies, maybe that person will be able to get, maybe you need somebody picked up from the airport for you. They have family volunteers as well that offer those things for you. They have therapy pets, all different types of pets that can come in to really bring your child some peace and calmness and maybe a sense of home if they have a dog at home that they enjoy. There are holistic therapies available like massage and Reiki and acupuncture. Know that housekeeping will be in your room every single day, and you really do start to bond with these people who are taking care of you and your child and keeping your child in a safe scenario there. The x-ray techs come in on the regular as well, and you start to build those relationships. Maintenance will ultimately come in, especially the longer you're there. There may be problems with the negative air pressure system or the air conditionings or your bed or your TV, who knows what. There is spiritual and religious support available to you. And there are also sitters available to you. There were just certain times when we were really struggling with Evan, especially as we made the turn toward him losing his life. And there were just times that he needed so much attention, and I just couldn't stay awake one more second. And they would bring in sitters that would just simply sit calm and quiet and keep him safe. And then know that there are going to be special visitors, athletes and characters, and really so many other people. I will tell you, for us, that because we were so far away from home, and my daughter Mary went back to the Ronald McDonald apartment every single night alone. If my husband and my children were not able to come visit at that particular time, I had somebody every week for 5 months come to Minnesota to care for us, to prepare food for us, to be able to sleep with Mary, to keep her company at night, to be her consolation in those dark hours alone. So this can look very different depending on where you are. And I think, it's a little challenging as well. I think going away for me was better because I can imagine being close to home and being barraged with visitors. I think it's important to understand that keeping your child safe is your primary role. And that means limiting the people that are actually coming into your negative pressure room and beyond. I think it's important to know for you the available resources to you within the hospital. There are going to be many areas of respite for you. Beautiful, lovely fountains and nooks for you to just find some time for yourself. There are interfaith chapels for you. There are restrooms, of course, and showers. As I mentioned, stayed in the hospital 24/7 for 5 months straight. I think that there were maybe 3 or 4 nights the entire time that I left the hospital and did not stay with Evan, and either my daughter or my husband were with him. But I would walk down the hall with my little shower kit and in my pajamas and get my shower most days. Especially when I was able to get outside and walk down the stairs to the Mississippi River and get my exercise in when we had good days. There are lounges, and I will tell you, over the course of our 5 months, that I connected with many parents and hosted many a cocktail hour in those lounges when you had an opportunity to just bond with these other parents going through this really tragic circumstances with their children, but being able to, commiserate with one another. There are conference rooms available to you should you need them. There are playrooms, not only for the patients, once your child is able to get free from their negative pressure room, but areas for the siblings to participate in too while you're with your child, or perhaps, you and your husband or husbands or spouses or partners want to be together with your children. There is the little kitchens that I mentioned to you with microwaves and a big refrigerator where you're able to, prepare little meals or heat things up for you. Technology centers and family resource centers. And as I mentioned, there may be a TV or radio station within your hospital, a cafeteria, and so much more. I think it's important to know that, during this time, you have an opportunity to continue your children's education, but you also have the opportunity to put that education on pause at any moment in the journey. And there will be pauses, I guarantee you, in the process. And to know that your child will be just fine to take that pause for all of the time or some of the time, but there is education available to your child during the transplant process. I want to just mention in our last few minutes that it's important to know that, that things don't always go as planned. I almost titled this presentation, We Just Don't Know, because I think, and Dr. Lund will agree, and all the other transplanters out there will know, that the words "we just don't know" come out of their mouths more often than they like, and I will tell you, more often than we parents want. And that you will hear "we just don't know" dozens, if not hundreds of times over your transplant journey. And you have to be understanding that we are all, regardless of our role in the journey of transplant with our boys, doing our best, taking the most current science and evidence and anecdotal information that we have and providing it for our children. But the children may at some point need support with their airways. They may need, as you see my bald, beautiful Evan here with an NG tube, nasal gastric tube, providing him some nutrition. You may even have a child put on a ventilator, as you can see up in the top right corner. And I want to assure you this, that I saw many, dozens of children that were as sick and as hopeless as possible, vented and potentially trached, and in really scary scenarios, who are now alive and vibrant young adults. So no matter how tragic the situation is, our medical technology, connected with a little bit of luck and hope and prayer, can really end up, no matter what happens to your child during the journey, allow them to come out on the other end as vibrant young people. And even with this young man in the wheelchair here, during the course of transplant, depending on, how sick they've been and how immobile they've been, they may need to use a wheelchair until they get stronger. So all of these things, are things that you don't necessarily plan for, but the care team is there to walk you through and give you hope in the process. And then, as Dr. Lund mentioned, some 3 weeks, 4 weeks, who knows how many days, your child gets to walk out of that hospital room. They may not get to leave yet to your home away from home or your respite home, but they get to leave the hospital. And you can see Evan here with his twin sister, Elena. He has got a million wires attached to him. He's got his mask on, he's got his pole behind him, and he was loving just walking around and being free. And this is 28 days, I think it was, that he was able to do this. And you can see he was up and walking and just really enjoying being outside, that sweet bald-headed boy. We even brought him some little treats. You can see him with Elena here enjoying a Coke. I will tell you, back in Minnesota, the pop in Mama G's world, right? All my nutrition clients, you know that this is a no-no, ever, never, ever. But for that sweet boy, he got whatever he wanted. And there it is, right? We just don't know. We just don't know what this journey is going to look like with newborn screening, with the diligence of our transplanted and all the researchers in our ALD world. I have to just communicate how much hope you all have. It is so different than it was for our journey with Evan some 14 years ago. But I think what's most important is, let me introduce you to Evan once again. You can see his little central line right there. This is Caroline. Caroline was a little girl we met during our transplant visit at the Ronald McDonald House. Caroline had JML, a very, very serious form of leukemia. She had had 2 bone marrow transplants at that point and was getting ready to have her 3rd. And I don't know how we talked anybody into it, but we were able to have Caroline visit us every single day in the hospital when Evan was there, until she went in for her 3rd transplant. And I want you to really take what I'm going to say to heart. These children did not want this journey. These children did not deserve this journey, but these children had patience beyond patience, and learning patience and fortitude by watching what your child is going through, and then emulating and role modeling that patience throughout the BMT journey to every single patient, parent, practitioner, care team member, individual that you meet in the journey while you're in BMT is really important. You will have moments of meltdown. You will have moments when you will say horrific things to people who are on your care team, horrific things to your BMT doctors and your nurses, but they know what a tragic situation you have been tossed into, right? But allow Caroline and Evan, both now angels, right, in heaven, perfect and healed once again, to allow you to find that patience and fortitude that they had during this journey. Last thoughts. So many opportunities for support, Hope Kids and other foundations, the Ronald McDonald House and other homes away from home. I really want you to consider using the platform Caring Bridge versus using social media. Caring Bridge allows it to be away from social media. It allows you to have a document that you could actually print out at the end of it. It allows you to really share your journey and allow people to provide you hope and support along the way and have control of the scenario. We have things to talk about later on in terms of what to pack and being specific in terms of what help you need, the IEP and education opportunities, the potential need for a care conference, and when it's okay to say no and no more. And here I am, Mama G. The slides will be available to you if you need it. You will be able to find me at bahbad.org if you need me in terms of putting together any blood drives or bone marrow drives. If you want to reach me in terms of, oh, and I have bad information here, it's mamageslifestyle.com. But anyway, you all know how to get me. Let's get out of this share.
Thank you so much, Gina. I know that we're unfortunately
Out of time.
any of the questions that came into the chat, we'll have time to chat about it later. The last session of today's programming is going to be a call, and I know one of our regular support calls. And so all the experts who are able will be back. I believe Gina's going to try and come back and answer questions. And we're also, Gina wanted me to remind everyone that we're in the process of, there's much follow-up material that's coming after this. So ALD Connect is working on handouts and talking about how to prepare. And also, Gina is planning another follow-up webinar. See, I'll just keep saying it so that we have her booked. She's a busy lady, but we have a lot of more information that Gina and many of our other speakers have to share. So thank you so much, Gina. As always, you never disappoint. You are a force of nature. I'm so grateful. I'm so sorry that you're in our community, but I'm so grateful. So thank you, everyone. We'll see you at the next presentation that starts in just a few minutes, and be well.